Hi everyone. Welcome to the pre-training orientation to become a program leader. This webinar is for potential leaders, registered program providers, and other partners in Wisconsin who are interested in high-level evidence-based health promotion programs. I want to take this opportunity on behalf of the Wisconsin Institute for Healthy Aging and your local community to thank you for your interest in providing these workshops in your area. This video is to prepare individuals for the upcoming training to become a leader of this program. So we're going to start with an overview of the program itself, why it's needed, the proven outcomes that we know it has, and just workshop basics. Then we are going to talk about the reach that this program has in Wisconsin and the team that you're joining. Finally, we're going to go over what it means to be a workshop leader, what you can expect from us at WeHab, and what we can expect from you before, during, and after the training to become a workshop leader. As a master trainer, leader, and program lead for the chronic disease self-management programs, I'm going to tell you a little bit about the Healthy Living with Chronic Pain program. But first, let's define chronic pain. It's a discomfort that persists for over 3 months or more and be caused by many different factors, most notably chronic conditions. Pain does affect more Americans than diabetes, heart disease, and cancer combined. About 100 million Americans deal with chronic pain, and it's the most common reason that adults seek medical care. 4 in 10 Americans say that pain interferes with their mood, activities, sleep, and ability to do work or even just enjoyment of life. And 2/3 reported an interference with any one of those components. So pain is a major component of many long-term health issues, and it's also emerging as a health concern on its own. It impacts a person, their families, and society as a whole. Many struggle to find ways to manage their chronic pain. Since the most common treatment for chronic pain is pain reliever medication, older adults have been increasingly prescribed medications, including opioids, to manage this condition. And this can lead to misuse or abuse, often unintentionally. So while medications should be part of a treatment plan sometimes, a person's plan should also include a self-management program like Healthy Living with Chronic Pain. So a few consequences of chronic pain to mention are, in the United States, the total annual incremental cost of healthcare due to pain ranges from $560 billion to $635 billion, and that was in 2010, which combines medical costs of pain care and the economic costs related to disability days and lost wages and lost productivity. So chronic pain is the most common cause of long-term disability. The prevalence of pain has a tremendous impact on businesses. The annual value of lost productivity in 2010 ranged between $297 billion to $335 billion. And that value of lost productivity is based on 3 estimates: days of work missed, hours of work lost, and lower wages. So as well as having an emotional and physical toll on individuals and families, in a 2006 study, over 300 chronic pain sufferers, 2/3 of those reported that their pain, it impacted their overall enjoyment of life. And more than 3/4 of those reported feeling depressed. And then 86% reported an inability to sleep well. And all of these factors compound on poor health. But Healthy Living with Chronic Pain is here to help. So this is a high-level evidence-based program. It meets the U.S. Administration on Aging's highest standard for evidence-based programs. It was developed by Stanford University's Patient Education Research Center, and it's now disseminated through the Self-Management Resource Center, or SMRC, worldwide. Over the years, it's had a variety of testing, curriculum refinement, and research. You can find more about those research outcomes on the Self-Management Resource Center's website, bibliography pages, and also on the WeHab website. There's local data and also further resources. So this program is researched and proven to help people with long-term pain issues. Studies found that on average, people who have participated in the Healthy Living with Chronic Pain program have more vitality or energy, they have improved mental health, less pain, less dependence on others, and are more involved in everyday activities. They also report being more satisfied with their lives as compared to those who have not taken the program. The program has also been delivered and evaluated across pain clinics in Ontario, Canada. Evaluation of that program is found to be beneficial for participants in terms of coping skills, pain cognition, and overall quality of life. This program has some underlying concepts. One is that people dealing with pain issues have similar experiences and problems. So through these highly interactive workshops, participants are going to share, they're going to listen, and help each other over the sessions. Next, people must manage their pain and the impact it has in their lives and emotions. Leaders will help participants learn tools to increase their self-confidence in being able to manage their symptoms while learning how their pain affects their lives. We also know that lay leaders lead as effectively, if not more effectively, than healthcare professionals. Because what studies have found is that when health professionals lead a workshop, participants will learn more. But if a peer leads the workshop, participants end up doing more. And the latter helps maintain long-term behavior change. The last underlying concept is that the program process is important, or if not more important actually, than the subject matter itself. We know that people learn best by being taught a little bit and then having a chance to try what they learned out and then getting feedback and building on what they've learned. And it's through this process that participants get activated in their health and then they feel less alone in the whole process. So who are these programs for? They're for adults with chronic pain, such as low back pain, neck pain, or pain that radiates from your shoulders to your arms. Others may have fibromyalgia, headaches, migraine, pelvic pain, or some have complex regional pain syndrome. People who live with someone who have a chronic pain condition are also welcome to attend, and they get just as much out of the program as well. And something to note, while Healthy Living with Chronic Pain is not a program designed to prevent addiction or prevent pain medication reliance, such as opioids, it does provide participants with alternative methods for managing and decreasing their pain, and then also improving their mental health to help avoid misuse of pain medication. So what do we do and what do we talk about in the workshops? Well, each session has about 3 to 5 learning activities on various different topics. These are listed on the slide below, as you can see. Some of the key elements that are part of every session, though, are practicing problem solving and decision-making techniques, creating and completing an individual action plan, aka short-term goal setting. Also important, midway through the workshop, the group does learn a gentle flexibility program. It's designed to safely loosen muscles and joints and increase circulation for almost all people dealing with chronic pain. It's called the Moving Easy program. Lastly, the group contributions from the people that are attending really do drive the program's outcomes. So now that you understand the program itself and the need, let's talk a little bit about the training to become a workshop facilitator, or we call them workshop leaders, of the Healthy Living with Chronic Pain program. So you're going to attend the training in pairs or by yourself solo if you already have a trained leader to co-facilitate with back in your community. If you're already certified in another self-management resource center program, such as Living Well with Chronic Conditions or Healthy Living with Diabetes, you may opt to take the shorter crossover training instead of the full training. And then in the training, you're going to learn the issue and impact of chronic pain, as well as the impact this program has on those who attend it. You'll learn the Healthy Living with Chronic Pain curriculum. Essentially, you're going to get to see the trainers model each activity of the whole 6-week workshop series in the training. You'll learn new skills like group facilitation techniques including practice teaching in front of your peers and working through possible real-life scenarios. And then you'll also learn the various ways that you're supported through this process, locally and statewide, because we are all here to help you at WEHA. So missing even a piece of this training could greatly affect your full understanding of this program and its offering. So again, we must attend the entire training to become certified in the program. So who is appropriate to be a leader for this program? We are looking for friendly individuals who enjoy helping people and then can speak comfortably in front of a small group. Your time commitment as a leader is that you attend all the days of training, so be sure to confirm that with your employer if applicable. And then once you're a certified leader, you're going to need to block out, I would say, about 4 hours a week when you're actually leading the 6-week workshop series. And that's going to include prep time, conducting the workshop, and then any additional follow-up. This is a highly scripted program, meaning that the information that's going to be presented in the workshop is already set for you. You have to be comfortable leaving your medical hat or your personal theories hat at the door and follow the script as intended by the program developers. And the reason we do that is to ensure that participants' voices are heard the most. And then in the training, we'll teach you facilitation techniques and model skills to prepare you to lead the workshop with another certified leader. At least one of the leaders must have experience with chronic pain, personally or professionally, because together you're going to help others learn how to take small steps towards permanent positive changes and healthier living. We also know that people who are past participants of the workshop are strongly encouraged to become leaders because they do a great job. They've seen the impact of these programs firsthand on their own lives. Expectations of leaders include, like we said before, attending the full leader training, working with a local program provider, that you're leading the workshop in pairs, both need to be certified by a master trainer, and then lead 2 workshops a year, ideally, a minimum of 1 though. Adhere to the curriculum, use required materials that we're going to provide for you, and then we ask that you follow the WEHA protocols. And that's going to include things like a workshop notification form and data collection items, which we will go through in the training. During the training to become a workshop leader, you're going to receive your leader's manual, and that has all the instructions and the script to lead the workshop in your community. You'll also receive a copy of the Living a Healthy Life with Chronic Pain textbook, which includes the Moving Easier Flexibility Program CD. You'll receive a relaxation CD and a set of charts. And these are the items that are required for a leader to lead a workshop. And then for participants of the workshop, the Living a Healthy Life with Chronic Pain textbook is required during the 6-week workshop series. So your local area is going to be in charge of supplying this item to your participants. It can be purchased through Bull Publishing, which is on the WEHA website. The link is there, and we will walk through that with you. Just to give you an idea, some areas will have the textbook for participants to purchase, while others may have like a lending library where participants can use the book during the program and then give it back at the end. And all of this is going to be addressed at the training to prepare you. And then other materials needed are blank flip chart pads, painter's tape, markers, and name tags. And those are just general supplies you'll need to support your materials. Also, you'll need to have the ability to print participant handouts. There's not a lot. There's only a couple, actually, 2 handouts that you'll be needing to print. And then offering refreshments is a great courtesy to your participants as well. So we encourage you to do that. So next, we're going to talk a little bit about implementing the program in your area. We here at WEHA do believe that organizational support is essential for program leaders to be successful in implementing the workshops, which is why my position is dedicated to supporting all of you through organizational support efforts. Another step in preparation for your training to become a workshop leader is working with your program provider organization and area partners to be sure your workshops are a success. So to do so, WEHA has created a planning guide to fill out before training. And that just helps making sure that you're covering all the steps and planning ahead of time. But fear not, you're not alone. You're going to have a great support team backing you up. But it's just good for us to be able to outline the tools ahead of time so that you are aware. You can find the planning guide at the link provided on the Leader Training Schedule website page or at the beginning of the Leader application. And then in order to complete the planning guide, you'll want to start with 2 important steps. Number 1, identify your program provider organization, which we're going to talk about in a minute. And then number 2, if there are other local program providers or other organizations that are partnering with you, be sure to make contact with them ahead of time, just in efforts for collaboration. So in order to provide organizational support to our program leaders, we do have a process to engage local leadership through program provider registration. So program providers are organizations that deliver 1 or more WEHA evidence-based healthy aging programs in their communities. These organizations employ or support volunteer program leaders, and it does look different in every area. There might be multiple organizations in your community working together to deliver the program, or there might be just one single organization that does all the components. Therefore, there could be multiple program providers in a community. So who is your program provider? If your employer is paying your time and facilitating the workshops, they are your program provider organization. If you are a volunteer, your program provider is the organization for which you're going to be facilitating the workshops for. So whoever is supporting your time to do the workshops. Note that if you are on your own completely, please contact me or anyone else at WEHA. We will either assist you in determining a local organization that could be your program provider, or if that still doesn't apply, WEHA may be your program provider organization. So how to register if you're not currently registered already. There's a simple 1-page form online. You may contact me if you have any questions, but it is on our website, and it just includes basic things like organization, contact name and information, the WEHA programs that you are administering through your organization, and the geographic area that you serve. Know that all registered program providers are going to receive dedicated organizational support from WEHA. So you will be hearing from me on a semi-regular basis and are definitely not alone. So as previously overviewed, you and your registered program provider and possibly other partners in your area will fill out the planning guide together. As you work with your program provider organizations, you're going to plan the following to prepare for success. You'll select the dates and times for your first workshop, because we find that people, when they come to training with their first workshop already in mind and planned, that they're able to take the information that they learned from training and then implement it right away once they're back home. Because the sooner you lead, the fresher your skills are going to be, and then the less intimidating it feels. Then you're going to decide whether your workshop will be free or for a fee. You'll select and reserve a venue with appropriate room arrangements. Our planning guide goes into further detail around those requirements and recommendations for this. And then determine who's going to submit your workshop notification form to WEHA. That will be worked out with your supporting organization. And then what organization in your community that you're working with will receive workshop registrations. It should be noted that somebody who can speak about the program is best for this, and that way that they can help people with any questions that are related to the program itself. So as you can see, there's a handful of considerations to discuss with your program provider organization. And when your workshop is scheduled, the next step is going to be outreach and marketing materials. WEHA's website has lots of marketing templates already made for you to download and customize, so you shouldn't have to create anything on your own. And then you're just going to figure out who and where this outreach is going to be happening. Sometimes we recommend tracking what's working best in your area. That could be formally or informally, just to know, what recruitment methods for getting participants are working in your area. Know that we're striving to register 18 people for each workshop. We also do have a data collection. We have data collection materials for this program, which you're going to learn about in or right after training. So you might want to talk with your area about ways to fund and sustain the program as well. The materials that you're going to need are low cost, but a cost is a cost, and it's good to have this conversation early. I know you've just received a lot of information, but let me reassure you that it's definitely all an effort to see the bigger picture of these programs. And then further, we want you and your community to feel ready for the training and ready to begin workshops. So these last few slides are just going to briefly overview the support that's there for you as a leader, because the leader training is only part of the support that WEHA gives you. After the leader training, there'll be a post-training meeting, and that's usually held over the phone, and they happen about 6 to 8 weeks after your training. It's just a check-in. We're going to review some WEHA-related logistic items, but mostly we want to hear from you and your fellow trainees about how things are going and help you out with anything you need. We also have a leader section on the WEHA website, and there you can find all the resources, current handouts, and whatever else is needed to plan, organize, and prepare for your workshops. We have a leader listserv too. So after the training, your preferred email address will be added to our listserv or discussion board. And this is a group made up of all the active leaders around the state in the Healthy Living with Chronic Pain program. It's a way to share, to discuss, and to even get important update information from WEHA. And then ongoing technical assistance is really important for the success of this program. No leader should be flying solo. So building a local network of partnered program providers will not only be a great support to you, but it's also going to ensure program success and improve the health of the community. And we at WEHA are here to help you with that process as well. The more people that hear and learn about this low-cost, effective, awesome program, the better. So the more partners that we get involved, the better. If you don't know who your local program provider point person is or other organizations in your area that are involved, please contact me and I am happy to assist you. And then WEHA staff are available to help you with any questions. If you're confused about the curriculum or if you need advice about a certain situation, we're here to help. There's definitely no wrong door. If I don't have the answer, I'll definitely find someone who does. Our office is a wealth of knowledge and has some very wonderful resources at our fingertips. We are, as staff, experienced leaders and coordinators ourselves, and we also are continually collecting best practices from all of our partners around the state. So we're happy to connect you with people that may be able to help. And then periodically, we offer webinars about the program. The topics will be maybe about best practices or highlighting a local area that has a bright idea or showcasing any kind of new concept to try. Announcements about these offerings are going to be made on that leader listserv that I mentioned earlier. So bottom line is we want you to know how much we value your commitment and that we are here to help. So I hope you're feeling prepared and excited. Okay. So are you ready to become a program leader for the workshop? Your first step is going to be to complete the leader application, and that's found on the website, in order to save your place at the leader training. And know that space is limited, so get those applications in as soon as possible. We'll ask you to commit to the requirements outlined in the application. No surprises, we've went over those today. You're going to be sent a copy of those requirements with your application confirmation. Know that there's a training fee. You can pay by credit card during the application process, or you can contact us if you need an invoice option. Know that invoices are then sent after the training concludes. And then, as previously mentioned, fill out that planning guide with your registered program provider organization or organizations in preparation for conducting the workshop in your community once you are trained. And then lastly, keep your eyes on your email. We're going to send a confirmation that we received your application, and then once your application is reviewed by staff, you'll receive an approval email, and that's going to confirm your place in the training, and that will outline all the detailed logistics like time, location, any pre-homework or expectations. And then lastly, you'll receive a reminder email closer to the scheduled training too. So thank you for your attention today. If you have any questions or concerns, please don't hesitate to contact us. And then a big thank you also for being interested in this impactful work. These programs are so valuable to our community. It's valuable medicine. Your success betters their health and their well-being. So we are very grateful for your participation. We could not do it without you. So get your application in and we will see you at training.